we go out and take a little walk. Walks are fabulous, but I want you to do a more energetic walk. So I want you to be a little bit tacky, all right? I want to have a little bit of perspiration. And I share, women, we don't want to sweat unless we're at the gym. But you're going to need to have a little bit of perspiration. That tells me that you're getting your heart rate up, that you're getting a little bit of benefit from the exercise. And what you've also alluded to is mixing it up, having a little bit of strength training, balance, which reduces falls, as well as aerobic exercise, which makes you more metabolically active, helps you maintain your weight. I'm going to put on my osteoporosis hat because it is really babies, children, adults, and older adults. We need to make sure that that balanced diet has enough iron in it, that it has adequate calcium and vitamin D in order to ensure that your muscles and your bones can do the exercise that I'm asking you to accomplish. You have to have the building blocks for strength. You need adequate calcium, adequate vitamin D, and most of us, it shows in the United States, we don't get either of those. Our children, what are they drinking? Soda pop and such. They're not drinking milk like the generations before, so we have to really look at what the diet contains. Vitamin D, we're not getting enough. Vitamin D, you need at least 800 international units a day, and calcium, through some process, we need 4 servings a day. That means milk, calcium fortified orange juice, maybe even supplement medications, but you need to ensure that we're getting that through an adequate, healthy diet. We want to make sure through the lifespan, so that when we're 25, we're 45, or we're 65, 90, that we are able to accomplish the activity that is important to us for quality of life and for health. We're talking about, for instance, longevity. We've been talking about physiology, maintaining your weight. Is there anything else that we need to think about with regards to elevated blood pressure? I asked the people here today to think about that elevation in blood pressure. Do you know your cholesterol number? And I'm going to ask Dr. Cho to make some comment about that cholesterol and that panel.
So when we check for cholesterol, it's really important not only to know your total cholesterol, but to also know the bad versus the good cholesterol. So probably most of you have heard that concept that not all cholesterol is bad. Some of it is good and actually cardioprotective or protective of the heart. The number you really want to know is the bad cholesterol, which is called, in medical terms, the LDL. Okay? And where your LDL should be depends on you individually. So most people need an LDL under 190, maybe even under 160. But for instance, if you have diabetes, you really want that LDL to be under 100. And that's very difficult to do just with your diet or exercise. It probably means you need a medication, okay? That's something to discuss with your physician. There are people who have diabetes who've had a stroke or have had a heart attack. Those people need an LDL cholesterol as low as 70. And there's even some thought that if you do have illnesses such as diabetes or you've had a stroke, that regardless of your LDL, that the cholesterol medication is of benefit, even if it's very low, that there's some protective mechanism, not just by lowering the cholesterol, but the medication itself lowers your risk for having another heart attack. So there are very good medications out there. Of course, all medications have side effects and nothing's perfect, but it's something to discuss with your physician, because you'd be surprised at how low the recommendations are now, because we do feel like the lower levels are protective against having another heart attack or stroke.
Which kind of brings us to the summary. We're starting to wrap up at this point. Cardiac disease, heart disease, heart attacks are far unappreciated in women. And in fact, women present very differently. Women can be missed even with good presentation. So I wanted to make sure that we touch on cardiac disease or heart disease. It is the #1 killer of women, and it is far under-recognized. Some of the things that we've talked about are risk factors: an elevation in weight, elevation in blood pressure, an alteration of the cholesterol panel, leaning more towards that bad cholesterol. The good one is the HDL. So I always tell my patients, heart protected. The HDL is good, the LDL is bad. And that allows me to bring up for Dr. Cho the diabetes. So some people have diabetes, but also impaired glucose tolerance, metabolic syndrome, increases the risk of cardiac disease. And can you tell me a little bit about that?
Sure. I mean, there are many people out there who have diabetes and don't even know it. But even more so, there are people who have what's called pre-diabetes, and that's sort of what Dr. Lambing is talking about. There's this whole gray area where your blood sugar might not be normal, but it's not high enough to have true type 2 diabetes mellitus. So in those patients, we do think there still is an increased risk for having complications, and it's important to know if you're in that gray zone, because that's the time that you really want to catch it and really want to prevent from becoming a patient with true diabetes. And some of the things that we're talking about, even just changing your diet, becoming more active with more exercise, might be ways to prevent becoming diabetic. And again, the risk factors, if you have the diabetes, are with losing your vision, losing kidney function over time, and those are things we certainly like to prevent. Diabetes has no cure at this time, but there is very good treatment to prevent all of those complications, and so it is a lot of work, but it can be done. So what I like to tell people is that it really depends on how much you're willing to engage and get control of the disease and not let it control you.
All right, our message today is really about health. Health for women, health for children, the young adults, and the older adults that we all know. You probably know someone with something that we talked about today. If we're emphasizing health, I hope that something caught your attention today, because now as we begin to wrap up with the discussion on stage, we're going to move to something the doctor is in. Your experts at Women Today are going to be here to answer your questions. Maybe there was something that caught your attention this morning that you'd like to ask a little bit more about in order to talk about that with your health provider, the person that provides you a medical home. I thank you so much. I thank Dr. Cho and Dr. Corey for joining me on the stage for Women Today Conversations in Health.